Can a man penetrate after he's had cancer of the prostate? Sex after prostate cancer might be different, but you can still get busy and sex can still be great. After non-melanoma skin cancer, prostate cancer is the most common cancer among men in the United States. 1 out of 7 men will be diagnosed with prostate cancer in their lifetime. The good news is most men diagnosed with prostate cancer, well, they don't die from it. In fact, nearly 3 million men in the United States who were diagnosed with prostate cancer are alive and well today. Boom! Now, prostate cancer occurs only in men because women, well, we don't have a prostate gland. And when cells in the prostate gland begin to grow uncontrollably, prostate cancer develops. So what does the prostate have to do with sexual functioning, you ask? Well, the prostate gland makes some of the fluid that is part of the semen. You know, the fluid men ejaculate when they are sexually excited. And right behind the prostate are glands called seminal vesicles. And that's where most of the fluid for semen comes from. The urethra is the tube that carries urine and semen out of the body through the penis. That tube, well, it goes right through the center of the prostate. So if a man's prostate is sick, he has a hard time releasing urine and semen. And when a man has an orgasm, the seminal vesicles secrete a milky liquid in which the semen travels. And this liquid is produced in the prostate gland. During an orgasm, contractions force the prostate to secrete this fluid into the urethra and leave the body through the penis. So if a man's prostate has cancer, it definitely impairs his orgasmic ability. And treatments for prostate cancer can also cause additional challenges. Some of the common sexual side effects of prostate cancer treatment include incontinence, when you can't hold your pee. Also, erectile dysfunction. This is one of the most common complaints of people who've been diagnosed with prostate cancer. And oftentimes after radiation or radical prostatectomy, the ejaculate will be dry. Some men also report orgasm without ejaculation. Now, the severity of the sexual side effects depends on the stage of prostate cancer when it is diagnosed. So now let's talk about sex after prostate cancer. Sex probably won't be 100% the same, but you can still establish and sustain a healthy and fulfilling sex life. Now, some changes are temporary and some are permanent, but all can be overcome. And depending on the stage of prostate cancer, men with an early diagnosis, well, some of them can resume sexual activity anywhere from a week to a month. And for those with more aggressive forms of cancer, it may take 1 to 2 years to restore some sexual functions. When patients or couples know what to expect, this can accelerate recovery. That's why I'm telling you about it.
Bugs love me. Seriously, mosquitoes can't stay away from me. But a few months ago, I started moisturizing my skin with Sense body oil and discovered this amazing oil also keeps bugs away. Plus, Sense smells so good, I even stopped wearing perfume. Smell good, feel good, Sense body oil.
When patients or couples know what to expect, this can accelerate recovery. That's why I'm telling you about it. It can get you excited about experimenting after recovery. Now, the super duper awesome news is that there are a lot of popular and effective medications out there. Ever heard of Viagra, Cialis, Levitra? Erection injections work for a lot of men. Now, these are tiny syringes pre-filled with medication that is injected directly into the penis shaft. The best treatment for you, it really depends on your overall health, and the best person to discuss these options with is your doctor. And while you're at it, ask your doc about non-medication options, such as a penile constriction ring. Now, this is an elastic ring that is placed at the base of the penis to help maintain an erection. It constricts the veins inside the penis to keep the blood inside. And this ultimately prevents the blood from leaving the penis and prolongs the erection. Talking to your doctor is really going to help you figure out the best option for you. And I know having this conversation might feel embarrassing, but believe me, your doctor has had this conversation before because you are probably not their very first patient. I hope not, anyway. It's also important to work slowly towards intimacy and use your imagination. While popular culture may be obsessed with sexual intercourse, there are just so many sexual activities that don't involve penetration. Remember when you were first falling for someone? Even holding their hand or gently swirling a finger in the middle of their palm could feel sexual. Want to get naughtier? What about sucking on a finger? And I have never known a lady who doesn't love being pampered in a bubble bath before being eaten alive in bed. And if you're bold enough to experiment with some adult toys, surprise your lady with some sexy gadgets designed to drive her wild, wild, wild. And guess what? Many women find these alternative sexual behaviors way more pleasurable than penetrative sex. I know a lady married to a prostate cancer survivor who swears that sex got even better after his diagnosis. You see, after his treatments, her hubs wasn't as dependent on his penis to do all the work. So we started relying more on his fingers, his tongue, toys, and his imagination. And guess what? She learned that his penis had very little to do with her experiencing the ultimate sexual pleasure of her life. Boom, boom. But to keep it real, that couple went through a lot of challenges before getting to that point. First, he experienced erectile dysfunction. And this was a couple that had never explored sex toys, but as it turns out, that's what saved their sex life. Then, he learned that erectile injections worked for him. And learning to experiment with new sexual strategies didn't only save their sex life, it opened them up to a whole world of possibilities that allowed them to create the sensual life of their dreams. Better than before. You heard me. Their sex life is now better than before his diagnosis. So guys, take the pressure off yourself. There's more than one way to skin a kitty cat. And lifestyle changes are a big part of recovering your sex life. A recent study showed that men with low-risk prostate cancer, it found that following an intensive, healthy diet and lifestyle regimen focused on low meat and high vegetable and fruit intake, regular exercise, yoga, stretching, meditation, and support group participation, it actually altered the way the genes behaved and changed the progress of the cancer by switching on tumor killers and turning down tumor promoters. So if you want to save your sex life, a healthy lifestyle may help you do just that. The point is, there are a lot of things you can do to reestablish a normal sex life with prostate cancer and after prostate cancer treatment. The key is to be patient with yourself. Remember that your sexual dysfunction is temporary. Sexual activity will resume when your mind, body, and heart are open to new ways of experiencing pleasure. It might be different, but let's be honest, sometimes different is good. So the road to recovery isn't always easy, but isn't experiencing sexual satisfaction worth it? Boom! I'm Dr. Sonjia, and I can't wait to see you next time at Sex in South Beach, where everyone comes to learn about sex.
And today's homework is go to sexinsouthbeach.com, join the VIP list. For your daily dose of nooky knowledge, subscribe to my YouTube channel and link up with me on social media. For better sex tonight, pick up my book at Amazon.com, and you don't want to miss the Sex in South Beach podcast on iTunes and sexinsouthbeach.com, where everyone comes to learn about sex. The information provided in this video is for your education and entertainment and should not be used as a substitute for medical advice. Before taking any medications or making any changes to your health behaviors, talk to your doctor.